Welcome to New Orleans and to Tulane University, the Celia Scott Weatherhead School of Public Health and Tropical Medicine. We're excited to host another Super Bowl in our great city and honored to be hosting this research team, NFL players and their families here today. I'm Thomas Levis, Dean of the Tulane Weatherhead School of Public Health and Tropical Medicine. This study celebrates the achievements of health research, leading to improved health outcomes among players and their families in the National Football League. Tulane Weatherhead School of Public Health and Tropical Medicine is very familiar with advancing the health of the public, both locally and globally. As the first school of public health established in the United States, we have embedded our work in community, creating lasting relationships across the globe. We impart these skills and values to each of our graduates, and we pride ourselves on training the next wave of public health leaders. Tulane's academic excellence is on display in this study of other NFL players through the leadership of Tulane's alumnus, Dr. Alicia Weddington. Her training in health disparities and community-led research in New Orleans has direct impact on the study through her current role as Assistant Director of Engagement and Health Equity Research. We're especially excited to welcome Dr. Weddington back home and welcome you here today to celebrate the achievements through the work of this study. Thank you for joining us at the Celia Scott Weatherhead School of Public Health and Tropical Medicine at Tulane University, and we hope you enjoy your time here in our great city.
And I'd be specifically mention just how blessed Tulane is to have a man of Dr. Levy's stature heading such a critical school at a critical time. Dean, we really appreciate being here today. My name's Herman Taylor. I'm a cardiologist and professor of medicine at Morehouse School of Medicine and adjunct at the Harvard Chan School of Public Health, and it's a pleasure to be with you this morning. My job is easy here. I'll really introduce what's going to be an incredibly exciting panel and this interactive hour that we hope you will all take part in. Instead of acknowledging everyone who is responsible for making this happen today at the end, I thought I'd do a shout out at the very beginning, and that's appropriate because we have visionary leadership that's behind this. And a lot of them are watching in Boston, couldn't necessarily be here today, but I want to underscore the leadership of Dr. Ross Zavante. Ross has been an incredible guiding light for what we've done in the study over the course of the last 9 to 10 years. And his presence is felt, even though he's not here physically, in everything you'll hear in the discussions going forward. Also, I'd like to acknowledge the rest of the faculty that contribute to the Harvard Football Players Health Study, who are, again, with us virtually and will, as the event moves forward, participate as the opportunity presents itself. It's Alicia Whittington. Dr. Alicia Whittington has already been mentioned, a mover and shaker, someone who has done a tremendous amount of work to pull this together, alongside Paula Atkinson, who has been equally committed in her efforts on behalf of the players and an approach to a scientific analysis of life for the players after football. Again, thanks to Dean Levis, to Dr. Mora, Dr. Bowling, and Tom Augustin, all who have been a part of the Tulane side of putting this together, and without whom this would not happen. Finally, the players and their families who have contributed to helping us focus in on the right things at the right times over the course of the study as it has evolved over these years. A quick word about the Football Players Health Study, just to contextualize things for everyone. It is now a decade-long study that has assembled the largest group of living players, the largest study on living players in existence. Over 4,600 players have enrolled. 1 out of 4 of all eligible players, 1 out of 4. That's an incredible sample size if you're statistically inclined. And it is something that will allow us to make solid statements about player health after football and the influences of football, and maybe even before people got involved in the game. The insights, the leads that we pursue, we are very hopeful will lead to a better quality of life for players beyond football, which is, after all, as important as it is, only a fraction of the player's life. This level of community participation has been critical to everything we've done, to the directions we've pursued, and to the discussion that you'll hear today. So it's been a collaborative work. Scientists, these great schools. I didn't mention that Morehouse School of Medicine is also very much involved in our work, and you will hear more about that in the future. But today, I would like to get underway by bringing forward one of our leading neuroscientists, who has been incredibly prolific in producing some of our work, working closely with Ross, and she is, without her, there are a lot of things that wouldn't get done quite as well. Dr. Rachel Grashow, I'll bring her forward.
Thank you, Dr. Taylor. So my name is Rachel Grashow. I'm here on behalf of the Football Players Health Study at Harvard University. I want to give you a brief overview so we can get started. The first thing I'm going to do is lay out the scientific framework that we use at the Football Players Health Study to guide our discussion. Then I'm going to call up our esteemed panelists. Discussion will begin. In advance of this event, we actually asked registrants, you, and those who joined virtually, to submit their questions to us. And I just want to say that we were blown away by the depth and the thoughtfulness behind those questions. We've curated those and put them together, and that's what I'll be posing to our panelists. When we wrap up, we're going to invite everyone to come outside and enjoy beignets and coffee on behalf of the Football Players Health Study. So let me do this, and then we'll bring you guys up, if that sounds good. Okay. So today we're talking never too early, never too late. And I want to begin with disclosures. So the Football Players Health Study is funded by the NFLPA, but we want to be very clear that there's a firewall between the NFLPA and the work that we do. They don't have a role in the design and conduct of our studies, the collection and management of data, and basically decisions we make on the scientific level. The Football Players Health Study receives no funding from the NFL, nor is any of our data exchanged with the NFL or the NFLPA. So I want to start by talking about just the general perception around football player health that we commonly see in conversations with players and also in the media. And it goes something like this. The idea essentially is that professional football encompasses a series of exposures and experiences that affect the brain and mental health. And over time, these contribute to cognitive dysfunction and decline. Now, this should look familiar. This should bring to mind chronic traumatic encephalopathy, a neuropathological condition diagnosed on autopsy. When I think about CTE, I think about the 3 Ps. The way it's discussed is that it's pervasive, everyone has it. It's permanent, there's no treatment or cures yet, and it's progressive in that it's just going to get worse. And this should probably sound familiar to most people here. But one of the things we want to bring attention to today is cardiovascular decline and dysfunction in former players. And what isn't really appreciated often or discussed is that actually 65% of deceased players pass away from a cardiovascular disease. And this is in contrast to the 14% that are attributed to neurodegenerative disease. And while both are important, we see that conversations sort of around football player health really lean towards the 14% and less towards the 65%. So we at the Football Players Health Study, knowing this 65% number, have asked ourselves, to what extent does professional football actually affect the heart and vascular health? And if we can look at that, what relationship does that have with this burden of cardiovascular disease that we see? And one of the reasons that we look at this is that unlike sort of this upper pathway that has no available treatments or cures yet, there are a lot of pharmacological medications, lifestyle, dietary interventions that if implemented have the chance to really change that number. And so that's one of the things we look at. What's often underappreciated in the football health world, but is very commonly known in medicine, is that the heart and the brain are very tightly connected. And when the heart isn't doing well, the brain doesn't do well. And so what we see is sort of like a twofer here, where by kind of going after this heart and vascular health, we're not only preventing or reducing cardiovascular dysfunction and decline, we're actually going after some of the cognitive dysfunction and decline that might come about from heart disease and other types of diseases like that. So, but if we're talking about the Football Players Health Study, and our motto is whole player, whole life, we don't just look at the heart and we don't just look at the brain. We're actually also looking at hormonal health and testosterone, at sleep, and at musculoskeletal health, all to reduce the long-term burden of cognitive dysfunction, cardiovascular dysfunction, and chronic pain and disability. But again, if we're saying whole player, whole life, to do it right, we also have to think, hold on one second. We also have to think about early life experiences. We know now that positive and negative experiences in childhood absolutely impact health later. I take great pride in the fact that the study really focuses on what are called social determinants of health. These are the factors that impact the lifespan, and these include things like experiences with discrimination and racism, childhood socioeconomic status, smoking, lifestyle, stress, financial security. Those pieces impact across the entire lifespan, and so they come into play with every single study that we do. So, as a scientist, my role, or the study's role, is really to understand every single one of these arrows. Does it exist? How strong is it? And what direction does it go in? And this can look intimidating for former players and their family at how complex this seems. But I want to paint a different picture really briefly, which is to say that what this also looks like is that every single one of these arrows is an opportunity for intervention. And I'll explain what I mean. For example, if we can improve players' sleep, we have the chance to improve their cognitive function, how their brains work, how their heart is doing, and chronic pain and disability. If we can intervene on, say, low testosterone, which many players don't realize they have, but we know is very common in players, we can improve how their brains are working. We can improve how their hearts work, and we can hopefully get at chronic pain and disability. So what might look scientifically like a very complex picture to untangle, it's actually many, many opportunities to improve the health of players, of living former players. Based on the science, and what we'll talk about today is science-based. We are a data-driven group, and we don't put anything up that we don't stand behind. And so what I want to say here is that we've created, working with our player advisors and our family advisors, a checklist that you'll find in your tote bags. And in it shows all the different conditions that we hope players will talk to with their doctors. Just go down and check them off and make sure that these things are addressed in the middle of all the other conversations they're having with their physicians. So, before we get started, I just want to say I hope that what we've done is broaden the narrative on football player health for our conversation here today. It is imperative that players, their families, their physicians, their health researchers like us, really look broader beyond simple frameworks and ask deep questions about the whole player, the whole body, the whole life. We want physicians and medical care providers to treat players as men first and players second, to ask what are the things that we can go after to improve their health, to reduce some of this burden of disease. And we'll continue to ask about synergies between social determinants of health and also the way that that interacts with football exposures. And I'll say too that all the football data that we've received, we also apply those to patients with single head injuries, and our work has broad implications beyond just the football player community. So I'm going to bring up our esteemed panelists now. If you guys will join us on stage. And what I'm going to do is I'm going to ask you, starting with Dr. King, to introduce yourself briefly, because there's a lot of credentials up here. and tell us why you said yes to joining us today. That's the question I would love to hear from each of you, and then we'll move into the audience questions.
Well, thank you so much, Rachel, Herman. It is an honor to be here. My name is Jonathan Kim. I direct sports cardiology at Emory University in Atlanta. I'm associate professor of medicine. I'm the current chair of the American College of Cardiology Sports and Exercise Cardiology Council. Been involved with the FPHS for some time now, and then leading up a new branch of the study focused on early aging and with in-person assessments in Atlanta, and that's going to be kicking off. So thank you.
Yes.
Why'd you say yes, Jonathan?
Oh, why did I say yes? Very passionate about football player health. So a lot of my research beyond my involvement with FPHS is very much focused on actual cardiovascular health among college football players as well. So this is a very big passion of mine, and excited to be here today.
Hi, I'm Joanne Pugh. I am a mother of a former NFL player. In addition, I'm a registered nurse. I'm also adjunct professor at a local college for School of Nursing. I am here because my son played in the league for an extended period of time, suffered injury, and is going through a transition period. With all of that in mind, I started an organization called the 50-Yard Line Mom. And the purpose of the 50-Yard Line Mom is to improve the health and wellness of players and their families throughout their total sports journey. So why am I here, and why did I say yes to this program? It's because of what I saw as the passion that Harvard has for the overall health and wellness of the players, and also because they were looking at a player from a holistic perspective, and that's something that I think is extremely important.
Thank you. It's very nice to meet you all. My name is Hagar Olgendi-Pierman. I am an NFL wife. My husband played 9 years in the league. Most of our time was with the Cincinnati Bengals. I'm also a physician at the University of North Carolina. I'm doing my sports medicine fellowship there at UNC this upcoming year. I wear many hats. I'm a mom to our 5 children, and I'm the vice president of the NFL Wives Association. So I bring together a very unique experience in that I've sat on both sides of the coin, so to say. I've lived the life of the NFL. I've lived the life as a physician, and I'm learning how those two things work together. So it was a very easy yes. I've come to know this team well, even in my own research work during my time here at Tulane, as we were working to establish the trust here at Tulane University. So very easy yes, because I stand here not just as a voice for myself, a voice for the NFL player, and a voice for the NFL family.
Hi, everyone. I'm Jim Kovach. I'm a former NFL player, having played actually in the Saints for 7 years. And during the off seasons, I went to medical school at the University of Kentucky. And after that, ended my career as a Niner, went to Stanford Law, and then got interested in the biotech industry. And since then, I've started companies in cell and gene therapy and other areas. I am here because just looking at what Harvard has done, and importantly, the cohort that they have and the data that is now becoming available is so powerful. And as we enter the era of AI and machine learning, there's so much that can come out to benefit individual players. So you have a group of people statistically significant, but from that, with additional work, can come out and really kind of develop precision approaches for all players as they leave the game, and even players my age. I was telling someone that I remember those rare days in the 80s where we'd win a game and we'd go down to the Royal Sonesta and actually have a beer, but so that just seems like yesterday, but it was a while ago. But it's an exciting time in life technologies, I would call it. And I'm here to see how I can help Harvard in its mission.
Thank you. So I'm going to start with the first question, which is, what do each of you see as the greatest health challenge for players right now and their families? Anyone can take it.
I'll start. I think denial. What I have found with my son is that he is a former player. Former players are used to being the epitome of health, but when things change, it's really hard for them to accept it. And without accepting it, it's hard to have impact on your health moving forward. And it also affects the families as well. So that's one of the reasons why I'm very, very passionate about this work that's being done, is that it's not only looking at the player, but it's also looking at that family member. But I truly believe that it's denial of where you are in your current stage of your health journey.
I would definitely agree. I would say the biggest health challenge, especially in the time of transition from the NFL, is learning what your identity stands for, and that a lot of these players will rely on their identity, and it's easy to do. I think of myself as an athlete as well. It was something easy to do to correlate that my worth comes from who I am as an athlete, and that my success as an athlete defines my value and where I'm going next. And that feeds into their self-worth, and it feeds into, especially in their time of transition, how they look at themselves and how they work to advocate for themselves. So if they don't feel adequate enough, then how can they stand and advocate for themselves in their time coming out from the league? So I would say the biggest health challenge is just them being secure in that they are more than football, and they can stand on that they are more than football and advocate for themselves with that power.
So I would just kind of build on what you guys just said, and I think a lot of it's focused on having the right education of where the risks are. The most common cause of death among retired NFL players is death from heart disease. So does that mean that I am discounting the impact of head trauma and brain health? Absolutely not. But I loved Rachel's talk, and I loved how she put it all together. And what I hope retired players understand, and what we try to educate college players as well, is that cardiovascular risk begins early. So my work with the FPHS is totally separate from what I do in Atlanta, which is the study of college players. So many of you may be surprised in learning about some of our data, which is by the time college players hit their senior year, we have data to show longitudinally that almost 80% have at least stage 1 hypertension. And that has implications in terms of what the heart looks like, as well as other factors as well. So I think our data very much melds very nicely as it relates to what's been shown with the FPHS over time, whenever you're looking at a player now 50, 60 years old. But understanding that heart health begins when you're an active player, and that needs to have that attention once you're done playing, is a critical message. And I'm still not sure that every player understands that. And I love this event, and I love all the work that Harvard has already performed with this study, because I think we need to continue to push that message.
Yeah, I thought it was fascinating, the linkage between cardiovascular and cognitive health that Harvard has put together, and it's going to talk about a little bit more. I mean, I myself had considered them somewhat separate. When you talk about challenge, it's like something to overcome is how I think of it, and recognizing the pervasiveness of cardiovascular disease and issues, and people have commented on that. But in terms of the connection to cognitive health, the fact that we still, to this day, know so little about the etiology and the pathophysiology of neurological disease. And we know they're overrepresented in former NFL players, but there's still, there's still much to be learned about what is actually driving that. And so to me, a challenge would be to, keep players educated on what's going to be some, in the next 10 years, I think we're going to be a sea change in terms of understanding those issues. And so it's really about, practicing, having good practices and basically staying involved to be right at the forefront of changes that could be made and even therapies that could be developed.
Thanks. I think that our work is based on the community-based participatory research model, which means that our research is player-driven and family member-driven. One of the things we heard often was that players felt older than their age, and we heard from physicians that in some respects, players appeared older than their chronological age. And so we've been investigating this question about early aging. And so I wanted to pose to you all, how do you understand potentially premature aging? Is it something that you see both with your loved ones or in your practice? And how is that something we can think about as a study and as a community?
Well, I am a sports cardiologist, as I mentioned, and so the topic of early aging is in retired NFL players is highly pertinent. And when I heard about what the FPHS was proceeding with, which is the early aging IPA, it allowed me to reflect on my panel of patients who are retired players, some of whom certainly don't appear to have early aging, but many of whom do. There's certainly a toll that comes with being a competitive football player over the course of a lifespan. And so I do think it is a very relevant study as it relates to the health of the retired player, and then tying in all of the different aspects that you nicely summarize as it relates to all of those different metrics. So that's what I think of as it relates to specifically the population that we're studying.
Yeah, one of the opportunities I had was to be involved in the aging as a scientific area through the Buck Institute for Research in Aging, and there were basic research, but there's genetic approaches to actually looking at aging itself. And it occurred to me, it's like, I just find it fascinating. It's not totally on point, but the fact that if you have 10,000 or 20,000 former NFL players, just looking at kind of selection related to how those players made it to the NFL. Well, they have to be bigger, and they have bigger muscle mass. Their exercise physiologies are better. They don't get injured as much. There are underpinnings to why a football player has a phenotype, and it could be that what is helpful, kind of in a Darwinian sense, early in life, has a counter effect later in life. I mean, that's something that to really that needs to be studied a little bit more. But in terms of actually feeling it, I feel like kind of underpinning a lot of it is the orthopedic aspect of playing in the NFL. At least when I was playing, with the AstroTurf was not very good back then, and there were a lot of falls, and so much better now. But what it does is basically impact. It's kind of like the Harvard. You had that graph up there. It impacts so many different areas, because you can't exercise as much, and you do feel depressed, and you do, it just has a major impact. So to me, if we could, we're going to take all of these things and kind of solve them independently, but I do feel like there's an interrelatedness between some of the orthopedic injuries. It kind of is a base root of causing and driving other things.
Yeah, I think it's really important. When I think about my son and some of the other players that I engage with, there's so much that they experience that they feel like is normal. The aches and pains and the things that probably us as non-athletes or lay people would be in tune to and want to think about how to address, but to them it's normal. And I think it's important for studies and research, and even more importantly, communication. This may not be normal. This may be something that you need to address. And education to me is power. So I know if there's data that shows that there's opportunity for players to have earlier aging than others, what can I do to offset that? But I think the main thing is really understanding, having the information, and I'm going to go back to what I said initially, the denial. Really being in tune and not being fearful of sharing some of the signs and symptoms that you have, and to be able to discuss those.
Yes, I mimic everyone's opinions in that the brain and the body don't work independent. They work together. And as I reflected on this data, there's such power in this data that I can't tell you how much birth. So not only do players undergo tremendous stress in their bodies during their time of play, but as they're transitioning and as they're long since retired, they live in, I would say, in such fear of what could come. So I was thinking of just how much cognitive dysfunction is highlighted. I mean, when my husband forgets his keys, the entire family, me and him both think together, well, should we pay closer attention? Should we get him to the doctor? When it's just a simple, memory lapse and something that everybody experiences. But there's such a standard and such a fear that's proclaimed in a sense that this is the path that you're walking and this is your end destination, when that's not the truth. And there's so much potential for intervention, just as you had shared. But there's such a burden in that could potentially lead to what we're seeing as far as early aging.
Yeah, it makes me think of the N of one. A single player, having retired, knows himself very well, but oftentimes doesn't know where he fits within the broader scheme. So you basically, one of the things I've seen from the Harvard study is looking at, questionnaire-based, do you have CTE? It's like, how do you know if you have CTE? I mean, you played a lot of ball, you hit your head a lot, but it's hard. It's hard to, you may be depressed, and so if you're depressed, maybe you answer that, So that is the power of the football players study, is numbers. And so what I know that is being talked about is really how to continue to translate the N of one of how someone feels and reacts into, take advantage of the fact that now there are numbers that are statistically significant. So many things can be done to kind of parse out, more knowledge, from this.
Can I just add one other comment? And this really builds on, I think, both of you talking about denial, Joanne. I mean, I couldn't agree more, athletes feeling invincible, but this really ties in nicely as well with what you already heard and what I initially said as well, which is hypertension. So hypertension is, as probably many of you know, is referred to as the silent killer because you don't feel it. And I think one of the challenges when you have kind of the invincible athlete, if you will, I see this a lot among the college athletes I care for, is, my blood pressure 150/90. I know what you're telling what I need to do. We may get to a stage where I'm talking about initiation of medications. I don't want to do that, doc, I'm sorry. And that kind of persists for years and years. So when we talk about the concern of forgetting the keys, for instance, again, I think this gets back to this point of education. So everywhere on TV, it's about, oh my gosh, I have CTE, whereas the reality is hypertension is a big causal agent for cognitive decline. And that has to be recognized, I think. It needs to be emphasized. And it doesn't mean that CTE or whatever that is whenever you're alive doesn't have impact. But managing hypertension can 100% prevent potential cognitive decline, as well as some of the other features that we talked about. So when we talk about early aging, I think it is the lack of attention to appropriate blood pressure control, which is so simple and should be followed by your regular doctor, that can make dramatic differences.
Yeah, it'll be interesting, though, to kind of understand from a pathology perspective the interplay between hypertension and CTE. I was talking to Jonathan about it, and one thing could be inflammation, right? That's an entire course. We don't have time to go into it, but I do see that as a driver of aging. You were asking about, that definitely in terms of senescence and then the secretion of cytokines that cause this inflammatory. You're always on. Your immune system's always on, and that's definitely not a good thing. So just wanted to point that out.
I will say, too, that, you brought up us asking if players thought they had CTE. It was a difficult decision for us to even ask because, it's so confusing because you can't actually know until someone's passed away.
Yeah.
But what we found, it was really informative because what we saw is that men didn't think that they had CTE at random. We saw that there was a lot of commonalities between the people who had that concern, and it's the stuff you're bringing up today. It's a lot of them had hypertension, they had sleep apnea, depression, anxiety, and low testosterone. And so to the extent that we are waiting with bated breath for advances in CTE treatment and technologies and identification, we just keep kind of coming back to the fact that hypertension is treatable. low testosterone is treatable. And so we worry that all these conditions that cause cognitive issues are, as you say, triggering players, and that the stuff that could be treated isn't getting treated. So, but that was a difficult question for us to ask, and I really appreciate you bringing it up.
Yeah, full disclosure, when asked, I said, I don't have CTE. So
Okay.
just wanna-
You can disclose that. We can't. So I wanted to go back to something that has come up already, which is, what are the challenges that you encountered or that your families encountered or your patients encountered during the transition? How do we use those challenges to help inform us about what players need?
So I would say that my husband played a significant time in the league, and he would tell you everything I share is in honor of him, and everything that he would be okay with me sharing. So it was a difficult time to transition for us. We had 2 season-ending injuries, and he was not mentally prepared for that transition. We thought we had 4 or 5 years left to continue playing. So when that transition came so abruptly, he had to figure out, well, what else does he love to do outside of football? And that's something that's very difficult to figure out when you're in your mid-30s and you've spent your entire life committed to the sport of football and committed to excelling and reaching the pinnacle of the sport of football. So that transition period was incredibly difficult for our family, and it takes years to try to overcome. And if you connect with the NFL Sisterhood, it's common knowledge that to support the significant others in that season, it does not take a heavy hand. It takes a very gentle hand, and to allow the time and the space for the players to come to whatever decision they are to come with about what they're passionate in pursuing in the future. It takes gentleness, it takes patience to help in that transitional period, and a reminder that, again, their worth is more than football. It's always been more than football, and it will continue to be more than football. And then how do you sustain, just speaking from the NFL wife experience, how can you sustain your family unit in that transition period? Because I firmly believe that the NFL players' health strives when the NFL unit is together, and the NFL family is united and together and standing on a common front. So how can we sustain as NFL wives the family unit so that he has the space and the potential to be able to learn what he wants to pursue in the next season of his life? So very much multifaceted, a very difficult thing to do in transitioning from the NFL, but it's a very beautiful experience to come to learn more about yourself, your significant other, and your family unit in that time.
I'm going to tag on to what you're saying. My daughter, I do have a daughter. Most people hear about my son, but I do have a daughter. And I can recall on the day of my son, his name's Jordan, on the day of his draft, my daughter, we were all celebrating, and my daughter said, "Mom, you know what? Today, Jordan got drafted." But really, the whole family got drafted. And there were no truer words spoken. My son left the league not because he chose to leave the league. He sustained a blow to the head, which caused permanent damage, permanent hearing loss, and as a result of that, has chronic vertigo that sometimes is just unmanageable. And I share this because he allows me to share this story. In addition to the vertigo, he has sustained ringing in the ears. So he is now married. At the point of his injury and his transition out, he was not. And it became not only a medical challenge for him, but also a medical challenge for the family. And as that challenge continues, I see what the family, his wife now, is challenged with. So it's ongoing. It's something that, to your point, it takes a village to manage through. But I think it really, really helps if we all understand and share the information and understand not only what the player's going through, but what the family's going through. What does that wife need? What does that child need? What does the sibling need? There were so many times that my daughter was engaged in everything that was going on with my son, but she was often overlooked. So it does take a village. It takes a lot of thought, a lot of prayer, a lot of persistence. and dedication to really addressing and advocating for their overall health, because there's times when they cannot. And then advocating for the overall health and well-being of the family as well.
Well, just to echo, I hadn't thought of it in a long time, but when I was forced to retire because of an injury, I was decimated, and I got depressed. I don't think about it that much anymore, but I'd reported to camp as the 49ers and then had to leave. I had to retire because I had a pivot shift in my knee and just was swollen. So in a day, every connection I had to the teammates, to the coaches, to my whole infrastructure was gone. And I remember I'd moved out to California, and my daughter was less than a year old at that time. And my wife was working in real estate, and so really my daughter's the one that saved me because I had no friends out in California. I just took care of my daughter, and we'd take drives together and things like that. So no matter how small the support group in terms of when you have to retire is really important in that transition. And no matter what you have in front of you and the things you could do, it's all the same because you put your entire life into it, and then boom, many cases it's gone. So it does take a village for sure. Yeah.
Well, thank you guys for sharing your personal stories. I wanted you to go first because I have no personal connection to. I didn't play in the league, if you didn't guess, and I'm not related to anybody who played in the league. And so it's really important to hear these stories because that's the gap I see. So when I take care of former athletes, they are past this stage. And I think it probably just emphasizes, again, you guys talking about it takes a village. It's still that emphasis on ensuring that the focus on the medical care, because this is a transition now, the periods where you will have to have the rapid weight gain and you're taking NSAIDs like crazy. I mean, all these things are, at least to play, obviously the chronic pain is an issue, but you're transitioning away from that. And now is the time really to be able to focus on, you know what, my hypertension that I had throughout my career, I can address this. I can lose weight. I can begin to shift towards aerobic exercise. And that's where somebody like myself or other healthcare practitioners can certainly potentially play a role within that transition. So I'd love to see more players during that phase. And it is a notable dearth when I look at my patient panel that I don't have a lot of 35-year-olds, and it's partly because they probably don't need to see a cardiologist, but perhaps if they did have hypertension that was refractory to medical therapy, maybe I could potentially play a role.
Thanks. So my next question that we got from the audience was, how have you incorporated health equity and health literacy into your work?
Well,
Yeah.
I can start with this. So this has become quite a additional passion of mine in the space of sports cardiology. So I'll just preface this, and I won't get into too much details because I know we're short on time, but in the world of competitive sport, self-identified black athletes are at higher risk of sudden cardiac death compared to white athletes. And that has been the statistic that we've known about for a long time. And we don't understand why. I think 10 years ago, there was a potential focus on where it shouldn't be, which thinking about differences in certain disease processes that may be present in different constructs. Of course, now we recognize that race is a sociopolitical construct. It's not a biological construct. And in the general population, social disparities are what drives these disparate outcomes, as Rachel talked about with the social determinants of health. So we begin to appreciate this in the world of competitive athletics and competitive athletes and asking the questions about how much social determinants play a role. And so I do think the environmental stressors of where one grows up, educated, the type of healthcare they receive, the type of access to nutrition, all that plays a role, whether you are a competitive athlete or you're looking at somebody and disparate outcomes whenever they're 60, 70 years old. So I think this is a really important focus. And when we look at the outcomes of retired NFL players, it should be looked at as well. I know that's an important focus of the FPHS. So I think that the focus again on social determinants of health is really mandatory for all of us involved in clinical medicine. And I'm happy to see the world of sports cardiology and sports medicine begin to focus on this as well.
You know, I like the fact that you said social determinants of health, because I truly, truly believe that that's extremely important to understand. I really believe, and well, I'm going to say this, you know, for MDs, they treat, for our ends we teach. And so what I do is really, really try to emphasize the importance of past medical history. If you know your past medical history, that can be a determinant, or not a determinant per se, but an indication of areas that you may need to focus on. And then I think as research and studies and all of those type of things comes out, it's real important to share that information in community, but share it in a way that can be received. You know, you have different levels of understanding of health issues, health care, of culture, to make sure that we are communicating and adjusting our messaging to the environment that we're in. But I really look a lot at the social determinants of health, but I also think that there's nothing more important than knowing your past medical history. You know, I shared with you my son, I talked about hearing. What I didn't share is that he has a very, very strong cardiac history on his father's side. And so not only am I sharing information about hearing health, but also, I'm also sharing information to him about the importance of really, really paying attention to his overall cardiac health.
I would say and as I wear many hats, but in my role on the NFL Wives Association, I'm in a season of more observing. So I am looking to see where I fit as an advocate in many different spaces. So when I think about the health of the NFL player, as an NFL Wives Association, is how can we come alongside the NFL player and make accessible to him all of the benefits that are available to him? How can we educate the NFL player to know what he has access to so that he can reap the fruit of all of his hard work and his time in the league? When I think about the NFL family, how can I invest into marriages and relationships, into the children of those NFL players, to extend to them any opportunities that are available to them that they might potentially not otherwise be familiar with? And then when I think about NFL communities, we've really been more intentional over the past several years in trying to work for a tangible product, so to say, in every Super Bowl city, in every NFL city. So just this week alone, as an NFL Wives Association, we taught 200 kids how to swim in the New Orleans community, and we left behind a significant fund so those children can continue to learn how to swim. And boy, was it powerful to see those kids in the New Orleans community in the water alongside NFL players learning how to swim for the first time. So for them to see their heroes who look just like them learning something that could be fearful to them for the first time was really something that was powerful and significant. So we are standing alongside NFL players, NFL families, and NFL communities to the best of our ability. So I would say that I'm in a season of observing of where the gap is and where I stand in that gap.
Wow, that's great. Well, we can only do what we have the background to do, and I'm currently in the mode of starting companies. I mentioned, I think, the golden era that we're entering of cell and gene therapy and precision medicine, immunotherapies, and biotech, I think, is really going to be quite exciting. And I would love to help and reach out to former players who, I've always known myself how intelligent you have to be to play football, especially at the highest level like that. And so just feel that there are opportunities, sometimes overlooked, for former NFL players to get into biotech or life sciences in companies and things like that. So would reach out to this group and others as well. If anyone's interested in working in a biotech company, I can probably help out, and that would be the thing that I could, do because of what I've done in the past. So, and the swimming part is funny. It's all makes me reminisce to the days of yore. We were in my early days. We trained in Vero Beach, Dodger Town. That actually was kind of a resort, and they had a big old pool. And we used to go into, swim, like on our days off and stuff, and try to get guys to come in and swim. They go, no, I'm not getting in the water. I said, come on. But it's amazing how many players were afraid of sinking. They
I just wanted to add one last thing, just emphasizing that focusing on social determinants of health is a priority. So we do have some data, which I think, and these are published data, where we actually looked at this within our collegiate football athletic population. And some really striking data when you look at self-identified black and white athletes who play at the highest level of college football. Actually, we have metrics to kind of estimate neighborhood where there's more neighborhood deprivation. So these are neighborhoods with poor access to education, healthcare, nutrition, et cetera, and there's a quantitative validated estimate out there. And we looked at this and found actually that the majority of black athletes, even participating at the Division I college level, came from more neighborhoods with disparities. So how much of this plays into early hypertension? These are really important questions to ask. Another really important question, and maybe something that everybody would find really striking, is we asked these players to complete the Everyday Discrimination Scale, which is a validated questionnaire about early or just experiences with discrimination. And it was really striking actually to see, even at the age of 17, 18, et cetera, that there was a striking gap. So an easy hypothesis would be that black athletes, young black athletes may experience more discrimination, but to actually see it with these questionnaires reported was, to me, very striking. And again, just emphasizes that all of these early experiences have to play a role, and we need to focus on this.
Thank you so much. I'm learning as we go right today. So I'm sad to say we have less than 10 minutes left. And so the last question that I wanted to ask everyone on our incredible panel is, what is the one thing players and their families can do right now to start taking care of their health? You can name two if you want, but we're going to start with one.
I'll go ahead and start, and I'll be brief because it's a bit of a broken record. Just emphasizing understanding where many of the risks are that former athletes may not be aware of. So please get your blood pressure checked. Ensure that if you are a younger former athlete as well, if you're older, chances are you know your blood pressure because you see your primary care doc. But whenever in your 30s and you're immediately out of the league, get a physical. See what your blood pressure is. I promise you what you'll find is a very high prevalence of hypertension that can be managed. Get a sleep study, maybe be on medicines, talk about diet. I mean, all of these things, focus on this at an early stage. And the one last thing I'll say just relative to that, because we were talking about concussions and CTE, et cetera, I hope people are aware of the data that has come from the FPHS. So these data are published where players reflected back on prior brain injury, and it turns out there was a strong association. Rachel can talk about this much more than me because she was the lead investigator on this, with hypertension later in life. So I'll get back to our college data. We actually had the opportunity to follow a small group, granted, but across their collegiate experience. And we went back because we had all these prospective data, and we went back and saw if they had a concussion. And we did a case control study, so we matched players up and we looked at those who had concussion versus those who did not. And what we found was that there was early evidence of cardiovascular dysfunction, higher blood pressure after 2 years, early markers of arterial stiffness, which is an early kind of mechanistic precursor to hypertension. And so there really is, you talked about inflammation. I do think there's a role as it relates to concussion and how that can affect the autonomic nervous system and potentially early blood pressure. So again, it all leads back to the cardiovascular system. I say that kind of tongue-in-cheek, obviously, as a cardiologist, but it is really an important point of emphasis. And hopefully more of these data come out and people can begin to really see the importance of why it's so important to have these early checks.
I would say my two comments would be really understand your family health history. That would be number one. And then number two is to learn to be a self-health advocate. Advocate, to educate the young men, young women, the families on how to advocate for yourself and for your family as it relates to their overall health and health care.
Yes, I would definitely agree with that. So I would mimic in that education. So not only for the player, but also for the player's significant others. So it's not intending to demean the players power in his own, right to act as he does. But there's a common saying in the NFL that to get to the guys, you've got to get through the wives. But a lot of times these guys won't show up to the physician's appointments unless their wives, request that they do. So there's a power in in strengthening and educating not only the players but the players' significant others, so that they have access to all the benefits that are available to them when that time comes, and they're prepared that once the NFL time ends, which it does, that they're prepared for what life might bring up ahead.
I know I've talked a lot about technologies, but my answer, if I had to pick one, would be exercise. Exercise as medicine is something that is very, very powerful and kind of cuts across a lot of the areas we talked about. Within that construct is the idea of squaring the curve. We're all reading about longevity clinics and living forever, and that's decades away, if it ever could occur. But here and now, in terms of retaining as much function as possible over time, so that ultimately, as when you pass away, which we all will, you've squared the curve of function. And we see it now kind of going down, in fact, some of the Harvard's graphs show that, but exercise is such a powerful drug in its own right, so to speak, and just can't emphasize enough of how important it is, like on a day-to-day basis.
These are great answers. So we only have a few minutes left. If you guys have anything you want to say on closing, I'd love to hear any final thoughts you have to share.
Well, just thank you again for the invitation to be here. It is truly an honor. It's an honor to work with former NFL players, get to take care of former NFL players, and be a part of this type forum where we can talk about how much the Football Players Health Study has learned and how much we're going to continue to learn. So it's really just thank you, and we look forward to continuing with this work as we move forward.
I would say the same. Thank you very much for having me. I know my husband is listening back at home. So as I shared, we have 5 kids at home, and in the transition from the NFL, he stays home most of the time with those 5 kids. So I hope that when you see me and when you see, where I've come from and where I'm at this season of life, you also see him and the amount of sacrifice and commitment that he's extended to me, and I'm very thankful for that.
Well, I just wanted to say that in 5 years, the amount of data that we'll have, even compared to now, which we have a lot, is just going to be enormous. And what I would hope in the future is that we develop systems. They're so good. I'm so pleased that the NFL and all the different NFLPA, the trust, the various different entities have programs to help us, to give us feedback as players. But really, what I anticipate going to be needed, I think, even a little bit now, is a method or mechanism to put the athlete a little bit more in charge of all that data. Because having gone to different screens and things like that, it's great to get information, but to really assemble it or help me assemble it into a proactive plan that I could follow just in a little bit more integrated fashion would be super valuable, and I just felt that I had to say that.
And I again want to say thank you. Thank you to the study. I've been on the advisory team for the last 9 years with the study here. And one of the things that I am so grateful for is that Harvard listens. And I'm pretty vocal. And I would encourage you to encourage others to look at the things that are being done out of Harvard. It's a holistic approach. And one of the things that I did not mention, and Rachel, is that I am so thankful that they're looking beyond the player. They also have the Football Players Health Study that focuses on that significant other. So it's called FMFL. And it's really focused on the wives and the family members. But that is the thing that I really want to get across and to share with others. And what I have also known and have learned and have experienced over the last 9 years is that not only does Harvard listen to the family members, to the advisors, but they implement what they've heard. So I just thank you all and ask that you continue to do that, because I see the benefits from what you all are doing here with my family and those in the NFL community.
Joanne, you teach us. And I will say that I think that just to what you're saying, Jim, as we close this down, is just that we see our relationship with the players and the community as bidirectional. We have a bunch of programs coming up that return really key health data to players when they participate: testosterone levels, cholesterol, inflammation. We are giving that information back because we know that it has to go both ways, and the players deserve to know more about their own health. And working with Jonathan, we're going to be bringing players for full body assessments. All this is coming up in the next year. We're going to do a remote blood pressure intervention. So we just really want to make it clear that we don't want to just take, we want to give back, because the trust that we've worked so hard to create with the community is our number one. You can't do good science without that trust. And so I just want to say thank you to our incredible panel for coming all this way. Thank you so much for joining us both virtually and in person.